reproductive system in the males. So this is the snapshot of the endocrinology behind the reproductive physiology of the male. Starting from the
slides are not moving. If you are moving, it is not showing that slides are moving.
I am moving, ma'am, actually. So
right here, it is not moving.
So this is the snapshot of the endocrinology behind the male reproductive physiology. So starting from the hypothalamus, which secretes the gonadotropic releasing hormone and as well as the adrenocorticotropic releasing hormone. So after that, the anterior pituitary secretes the gonadotropic hormones like FSH and LH along with the adrenocorticotropic hormones, which further stimulates the laying cells in the testes to secrete the testosterone, which is the main androgen, and along with that, Sertoli cells to secrete the inhibin and activin also. And apart from the testis, the ACTH also stimulates the adrenal cortex to secrete the gonadocorticoids or the sex steroids. So all these pathways and the neurohormones play a vital role in the spermatogenesis, or we can say the male fertility. So now again, slides are not moving. I don't know why.
Yeah, it is not moving.
Yes, ma'am, I am also.
Yeah, it is next slide. Yeah, yes. Yes, that was next slide. It moved. Yes, it's moving.
Okay, these are movements. So if we see from the starting of the from the conception, then what factors determine the status of the development of the male reproductive organs or systems and to start the physiology of that system. So in the prenatal period or the embryonic period, the Y chromosome is responsible, which causes the developing genital ridge to secrete the testosterone. This is the first source of the testosterone after the conception. And along with that, human chorionic gonadotropic hormone also causes the testes to produce the moderate quantities of the testosterone throughout the fetal life. Under the influence of this HCG, the laying cells and the Sertoli cells also secrete the testosterone, laying cell testosterone from 8th to the 20th week of the gestation. And then Sertoli cells secrete the anti-Mullerian substance to regress the Mullerian duct during the sex differentiation. And right from the birth till achieving the puberty, there is a childhood gonadotropic releasing hormone inhibition from the hypothalamus. Due to that, there is absence or the descent stage of the testosterone. So hence no primary or secondary sexual characteristics are developing in that phase. So after achieving the puberty, till the rest of the life, there is at puberty, this inhibition breaks and adult sexual life or life cycle begins. And now laying cell luteinizing hormone causes the laying cells to rapidly produce the testosterone that will be continuing throughout the most of the remainder of the life. So in Ayurveda also, it has been said that Shukram Chaiti Pitrijani, Shukra को पितृज भावों में काउंट किया गया है, because we have just seen that how the Y chromosome is responsible for the initial production of the testosterone, which will be leading to the further development of the male reproductive system. And that childhood inhibition of the GnRH is also well described in the संहिताज, like यथा मुकुल पुष्पस्य सुगंधो न उपलभ्यते लभ्यते तद विकासात्तु तथा शुक्रम ही दहीना. तो मुकुल पुष्प की सुगंध की तरह है, जब तक वो मुकुल पुष्प एक बडिंग फॉर्म में होता है तो उसकी सुगंध उपलब्ध नहीं होती है हमें. लेकिन इसका मतलब ये नहीं है कि उसकी एग्जिस्टेंस नहीं है. जब उसका विकास होगा, यानी कि प्यूबर्टी पे जब वो इनहिबिशन ब्रेक होगा, देन वी विल बी एबल टू परसीव दैट gandha or the odor. Like this is the upma given behind the inhibition till the puberty. So now next are the Sertoli cells. So after the laying cells, there are the Sertoli cells. Those Sertoli cells are the sustentacular, supporting and nourishing cells embedded among the spermatogenic cells. And they start to function after the puberty. So post-puberty functions are they secrete the inhibin and activin that controls the secretion of the FSH from the anterior pituitary. Also, the Sertoli cells secrete androgen-binding proteins, which in turn increases the testosterone concentration into the Sertoli, into the seminiferous tubules, and hence affecting the spermatogenesis. Apart from these secretions, the Sertoli cells nourish, support, and protect developing spermatogenic cells, which are undergoing various stages of the spermatogenesis. Also, they also phagocytize the excess cytoplasm of the spermatids as development proceeds to convert them in mature spermatozoa. Sertoli cells also control the movement of the spermatogenic cells and release of the sperm into the tubules. That is called the spermiation. And these cells also secrete a fluid for the sperm transport. And the most important function of these cells is the formation of blood-testis barrier, BTB, because this barrier divides the seminiferous tubules into two compartments. One is the basal compartment, that is the outer compartment which is in contact with the blood and the lymph. And another is the adluminal or the inner luminal compartment where germ cells develops. So this barrier prevents the passage of the cytotoxic agents into the place where the spermatogenesis is going on, and also stops the exposure of the spermatogenic cells to the body to prevent the development of the autoimmunity against the sperm cells, which can be breached by the many factors like the infections or the trauma to that place. And FSH also stimulate these cells to organize full maturation of the spermatids into the spermatozoa. So Sertoli cells plays a viable role apart from the spermatogenesis. So this is the basic process of the spermatogenesis. We all know that the spermatogenesis takes place from the puberty onwards, that is average age of 13 years. And the site is the seminiferous tubules, the adluminal compartment of these tubules. And hormones required for the spermatogenesis are FSH and LH secreted from the anterior pituitary. So the normal duration taken by this process from the spermatogonia to the development into a spermatozoon is a 65 to 75 days on an average. And up to 300 million sperms are produced each day in both testes, and a germ cell eventually give rise to the 512 spermatozoa. So if we see from the beginning in the yolk sac, there are primordial germ cells which develop into spermatogonial stem cells, which enter into the embryonic testis in the fifth week of the intrauterine life and remain dormant till the puberty because of that GnRH inhibition. And once the spermatogonia, that inhibition breaks, these spermatogonia start to deliver the process of spermatogenesis. So basically, there are these spermatogonia are arranged in 2 to 3 layers just inside the basement membrane of the seminiferous tubules. So some of them acts as a reservoir and remains undifferentiated near the basement membrane. They do not converted into they are not involved in the whole process of the spermatozoa. They are just for the future reservoir. And second part of those cells is undergoing the mitotic and meiotic divisions. Those cells leave the basement membrane, squeeze through that blood testis barrier, proliferate, differentiate, and develop into a primary spermatocyte, and finally release into the tubules. So the interesting thing is that during this process, when a spermatogonia is developed into the spermatid, all the cells do not complete the cytoplasmic separation during this proliferation and phase and remain connected via cytoplasmic bridges throughout the development process. And this fact leads to the synchronized production of the X and Y chromosome bearing sperms in the equal quantity, we can say. So providing the equal chances of conceiving the male or the female offspring. So after completion of this process from spermatogonia to the spermatid, so there is the next step is the spermiogenesis. In this process, there is no cell division. Simply, spermiogenesis is simply transformation of the spherical epithelioid spermatid into the elongated slender spermatozoa, which we can say that the mature sperm cell. And in this process, there are certain stages like acrosomal formation, loss of cytoplasm, excess cytoplasm, condensation of the cell material, development of the flagella like tail, and mitochondrial rearrangement to supply the energy needed for the motility of the sperm. And next stage after this spermiogenesis, till spermiogenesis, the sperm cells are attached to the Sertoli cells or embedded within the Sertoli cells. When they released from the Sertoli cells into the lumen, that process is called spermiation. So till spermiation, the spermatozoa are non-motile and infertile in the tubules and early portion of the epididymis. So till this state, the spermatozoa are not capable to fertilize an ovum. So next, to develop into a fertile sperm, there is the process of maturation. This stage develop motility. So the sperm, after spending 18 to 24 hours roughly into the epididymis in the tubules, they develop the motility. And after that, they are transported to the further parts of the tract. So leading to the storage of the sperms. The small part of the sperms is stored into the epididymis, but most part is transferred to the vas deferens. And these mature spermatozoa kept in deep suppressed inactive state.
Slide is again second slide.
Yes, ma'am. I am also
Okay. Okay.
So these matured spermatozoa are kept in deep suppressed inactive state by the inhibitory substances secretions found in the secretions of the ducts, and they are fertile in that storage place for at least 1 month. So if we see the endocrinological aspect, then for different phases of this spermatogenesis, different kinds of hormones are required or the responsible. Like for the proliferation and growth, the testosterone is always required in each and every stage. But along with this testosterone, growth hormone is also essential for the proliferation and growth of the growth phase of the spermatogenesis. For the transformation into the mature spermatozoa, along with the testosterone, FSH and estrogen are also required. So this is a structure of a single spermatozoon. We all know very well, so I will go through it fast. So the length of average length of a spermatozoon is 52 to 62 micron, and the main thing required for the like clinical practice is that lifespan of the spermatozoa. So lifespan after ejaculation is 24 to 48 hours at body temperature. But if we transfer this semen to the lower temperature, then the lifespan is several weeks, can be enhanced to the several weeks. And if we store under the temperature below the minus 100 degrees centigrade, like frozen, then we can preserve the sperms for the years. So this practice is also going on. So, and the lifespan within the male genital tracts is many weeks, as we discussed in the storage cases. So, if we talk about the various parts of a sperm, there is a head that is oval or elliptical in shape, flattened, elongated, and pointed, and the nucleus is condensed and situated posteriorly with the highly condensed 23 chromosomes with an X or the Y sex chromosome, and head is also encompassing the acrosome. That is anterior two-third part of the head is called acrosome, formed from the Golgi apparatus. And this Golgi apparatus, this part, like acrosome, contains the hyaluronidase and proteolytic enzymes, which play important role in penetration of the secondary oocyte. So, as Sir Agnihotri sir previously said, that apart from the number of the spermatozoon, the quality of the semen and the spermatozoa also matters in cases of the infertility. So, the second part is the neck that contains the centrioles, giving rise to the axial filament, and body contains the spirally arranged mitochondria, that is the engine providing the energy for the motility or the locomotion of the sperm cell. And the last part is the tail or the flagellum that propel the spermatozoon in the female reproductive tract by back and forth flagellated movements. And the average velocity of a sperm is 1 to 4 millimeters per minute through the fluid medium or the medium available within the female genital tract. So we all know that in this process of providing energy, the available mitochondria degrades. Hence, the paternal mitochondrial DNA carrying the mitochondria progressively degenerates soon after the fertilization. So this is the well-known fact that the mitochondrial DNAs are always inherited from the maternal side. So now there are three structures which have the secretory functions. So first is the seminal vesicle. So seminal vesicle secretes an alkaline. All these upcoming three structures secrete the alkaline fluid. Alkaline, sticky, viscous, and yellowish fluid containing fructose, prostaglandins, and clotting proteins, making the semen yellowish, cloudy, and clumpy. So these secretions add up with the spermatozoas and make the semen, and the physical properties described in Ayurveda exactly match the physical qualities of the semen because of these secretions. And the this alkalinity of this seminal vesicle fluid neutralize the male urethral as well as the female vaginal acidic environment, because acidic environment is lethal for the spermatozoa. And clotting proteins help semen coagulate after ejaculation. So there are the semen is ejaculated in the liquid form, then it undergoes the coagulation and then secondary liquefaction. So in general practice, we measure that time also. The fructose is the main energy source for the spermatozoa required for its motility. And prostaglandin suppresses the female immune response. Otherwise, the female immune response also can destroy the discharged spermatozoa within the tract. So all the uh, ingredients of the contents of the seminal vesicle fluid are viably important. Next is the prostate gland, which is found only in the males. So this gland secretes an alkaline fluid which contributes to sperm motility and viability. This secretion protects sperm cell from thermal and environmental shocks, helping in stabilizing the motility and acrosomal reaction.
Dr. Arvind, are you moving the slides?
Yes, ma'am, I am moving in.
No, but it is on still on second slide, not moved.
Yes,
Yeah.
ma'am.
Yes,
If
now
I will close and restart the slides, then I have
now
to.
move. Yes, now it is changed. Yeah.
Okay, okay.
Yeah.
So the the calcium of this secretion gives the milky appearance to the semen, which is called as sphatic abham in Ayurveda. And profibrinolysin and fibrinolysin causes the fibrinolysis. That happens in the secondary liquefaction state, hence maintaining the liquid state of the semen. And zinc stabilizes the spermatozoon chromatid and decreases its fragility. So in general practice, the zinc supplements are also given in the cases of the infertility. So next is the bulbourethral glands or the Cowper glands. So these glands are two in the number and secrete alkaline, clear, slippery, lubricating pre-ejaculate, which is secreted before ejaculation. And the objective of this secretion is to protect the passing sperm or prepare or to lubricate the urethra and provides cohesive jelly-like texture to the semen. This fluid increases sperm motility in vaginal passage and cervix by decreasing the viscosity. And one important feature is it prevents the sperm cell diffusion out of the semen, out of the vicinity of the ejaculated semen. So after going through all this, now we will discuss about the semen, the general characteristics of the semen. So semen is ejaculated organic fluid containing the sperms as well as secretion of the accessory sex organs like the prostate, bulbourethral gland, and seminal vesicle fluid. The appearance of the semen is translucent with white, gray, or even yellowish tint. The specific gravity is slightly higher than water or the urine, that is 1.028. And the volume per ejaculate, average volume of the semen is 2 to 6 ml. And the pH, as we discussed, it is alkaline, slightly alkaline, 7.5, which is required for the viability of the sperm. And if we talk about the consistency of the semen, it is changing in the first 30 minutes after the ejaculation. So at the time of the ejaculation, during and immediately after the ejaculation, it is liquid. Then it undergoes the process of clotting. So fibrinogen is converted into a weak coagulum by the clotting enzymes, and it helps keep the semen deposited in the vagina. So आगे हम शुक्र की परिभाषा आयुर्वेद में जो दी उसमें भी ये शब्द आएगा जब दिए गर्भ समुद्भाय जिसका धारण किया जाता है. Then next is the secondary liquefaction. So this coagulum is liquefied after 15 to 30 minutes of the ejaculation due to the fibrinolysis and helps the spermatozoa to make their journey towards the ovum after ejaculating in the passage. So this is the simple dividation that which part takes how much provides how much contribution to the whole quantity of the semen. So testes and epididymis, which are the primary source of the spermatozoa, are only 2 to 5% of the whole semen, and the major part is secreted by the seminal vesicle, that is 65 to 75%, and along with prostate, that is 25 to 30%. Cowper's gland secrete only less than 1% because this is responsible for the secretion of the pre-ejaculate fluid. So these are the physical characteristics of the Shukra Dhatu discussed in the various Ayurveda texts like Chikitsa Sthan, Sushusari Sthan, Ashtang, Hridaya Ashtang Sangha. So this is the summary. So in Ayurveda it is called Snigdha, which we can say the unctuous or providing the lubrication, Ghan or Bhel, viscous, that coagulum like stays, and then pitchil, sticky in the nature, madhur, sweet because of the presence of the fructose, and avidahi, neutral reaction due to the mixing of the alkaline secretion of the various glands. Avisra, no foul odor because of the clear and sterile media. And then guru, then that guru is also like ghan or bahel, and bahu, the quantity is abundant. So it is like 2 to 6 ml or 3 to 6 ml. And draw, liquid consistency initially and finally, but in between the it is ghan. And madhu gandhi, the odor is like honey. And the if we talk about the color or the appearance, it is shwet, shukla, sit or spatikab. Or at some places it is called like vritamakshit telabam. And various commentators also expressed their views that it is because of the prakriti of the Purush, like Vat Prakriti, Pit Prakriti, Kaf Prakriti. So according to the predominance of the Vat, Pit or Kaf, the color or the appearance may differ in person to person. But all these are the normal physical characteristics. So if we talk about the pH or the effect of the pH on the seminal parameters of the sperm. So neutral or slightly alkaline medium greatly enhances the motility, but mild acidic medium greatly depresses the motility, and even strong acidic medium causes the rapid sperm death. So we see that the in the urinary tract infections or infections of the urethra, the urinary alkalizers are used. So in cases of the chronic UTI cases, there is also infertility. So if we see the effect of temperature, the temperature increases the sperm activity or the motility, but at the same time, it increases the metabolic rate within the sperm cell also, which finally curtails its lifespan. So finally, the high temperature is not favorable for the conception, and high scrotal temperature causes degeneration of the seminiferous tubule cells except the spermatogonia, like the Sertoli cells or the laying cells can be damaged or degenerated because of the continuous exposure to the high temperature, like truck drivers or the professions which are like cooks working in the high temperature environment. So the scrotum, the position of the scrotum keeps the temperature of the site of spermatogenesis roughly 2 to 3 degrees centigrade below the core body temperature, which is essentially required for the spermatogenesis. So after that, aging and male climacteric, like the menopause happens in the females, there is the term male climacteric. So the natural or physiological decrease in the testosterone levels. So decline in sexual function due to the decrease in the testosterone levels, it is experienced physiologically. And this testosterone level dwindles rapidly after the 50 years of the age and becomes to 20 to 50% of the peak value by the age of the 80 years. And most men begin to exhibit slowly decreasing sexual functions in their late 40s or the 50s. And average age for terminating intersexual relation is 68 with huge variation. This is data of the survey study. And scientifically, there is a fact that at least some spermatogenesis usually continues until the death. So, if we talk about the male sex hormones, those are called androgens. So, androgens are the steroid hormones having masculinizing effects, and the two category of hormones comes under this. First is the testosterone, that is the responsible for the 95% of the androgenic activity in the males, and second is the adrenal gonadocorticoids secreted from the adrenal cortex. So the major functions of the testosterone are listed here, like male body characteristics development, masculinization of the male fetus even in the intrauterine life, sexual development of the male fetus, descending of testes, development of primary and secondary sexual characteristics, stimulation of the spermatogenesis, and after that, these are the secondary and some systemic functions. In testosterone increase the growth of hairs, especially of the facial hairs, chest hairs, pubic hairs, or hairs around and above the umbilicus, and decreases at the same time. It decreases the growth of the hairs on the top of the head. So it is a general practice for in the baldness treatment. Anti-testosterone are given there. And testosterone causes the hypertrophy of the laryngeal mucosa and enlargement of the larynx, leading to the adult masculine voice. It increases the skin thickness and ruggedness of the subcutaneous tissues. It increases the secretions of sebaceous glands, especially of the face, leading to the acne in the around the pubertal age. And it increases the protein synthesis, especially in the tissues involved in the male sexual characteristics, as well as the skeletal muscles, skeletal muscle mass. It increases the calcium retention and bone matrix, leading to the narrow pelvic outlet with high strength in the males. It increases the basic metabolic rate. It has also some effect on the erythropoiesis. Because of that, there is a variation in the normal ranges or value of the hemoglobin between the male and female. And it also plays a slight role in the electrolyte and water balance. So if we go towards the Samhitas, so like optimal or the chief function of each dhatu, the Shukra dhatu has various another functions also. It is said that Shukram Dharyam Chavanam Pritim Dehabalam Harasham Bijartham Cha. Apart from the गर्भोत्पादन या बीजार्थम जो इसका फंक्शन है, उसके अलावा बाकी ये फंक्शंस भी है. सो इन टोटल we can say the Shukra is responsible for the complex autonomic sexual behaviors, including attraction, desire, erection, copulation, ejaculation, orgasm, and finally leading to the fertilization of or the conception. So here धैर्यम, so डल्हन ने जो इस पे टीका की है, उन्होंने एक एक शब्द का अर्थ एक्सप्लेन किया है. धैर्यम शौर्यम शूरत्वम अतएव क्लीवा अधीरा. तो क्लीब व्यक्ति होते हैं, उनमें बताया कि धैर्य का अभाव होता है, क्योंकि धैर्य से शौर्य शूरत्व आता है, which can be correlated to the maintenance of non-disruptive optimal anxiety levels. Second is chavanam, shighratven avasransanam, the ejaculation at optimal time, like preventing the premature ejaculation or the delayed ejaculation. And next is pritim, that is pritim sneham pramadasu, pramada के अंदर स्नेह, attraction towards the female or the pleasure or the satisfaction resulting from the sexual act. Next is deha balam utsah upachya lakshanam, mental and physical strength. Harasham punah utkantha jananam pramadasu ev, again repeated desire of the performing the sexual activity with the female. And the final and the foremost function of the Shukra Dhatu is Bijartham. So iti बीज प्रयोजनम यथा ऋतु क्षेत्रादि संपत्तौ बीजम अंकुर जननम स्यात् एवं शुक्रम अपि गर्भ जनकम इत्यर्थ है. जैसे कि ऋतु क्षेत्र आदि जो संपत्तियां सब उपलब्ध होती है, तो बीज अंकुर जनन में समर्थ होता है, वैसे ही फेवरेबल कंडीशंस में शुक्र गर्भ जनन में समर्थ होता है. सो फर्टिलाइजेशन और द कंसेप्शन. सो ये शुक्र के बारे में जैसे कि थोड़ा सा कंट्रोवर्शियल भी हो जाता है कभी कभी, क्योंकि शास्त्रों में शुक्र के बारे में अलग अलग स्थानों पर जो बातें बताई गई है, उसमें कभी शुक्र से ओनली स्पर्म का ग्रहण किया जाता है, या कभी शुक्र से सीमेन का ग्रहण किया जाता है, कभी शुक्र से जो टेस्टोस्टेरोन के फंक्शंस हैं उनका भी आभास होता है. तो हम शुरुआत से अगर देखते हैं इसकी व्युत्पत्ति से शुक्र की, तो शुच क्लेदे धातु से उत्पत्ति हुई. शुच मीन्स प्योर, क्लीन और क्लियर, एंड क्लेदे मीन्स प्रोवाइडिंग द मॉइस्चर. सो यहां से तो क्लियर है कि ये सीमेन के बारे में ही बात कर रहे हैं. उसके अलावा चरक शारीर स्थान में शुक्र के लिए कहा है कि शुक्रम तद अस्य प्रवदंती धीरा यद धीयते गर्भ समुद्भवाय, सब्सटेंसेस विच इज responsible or which is deposited into the vaginal tract for the garbhotpadan, for the reproduction. So it is okay, it is again indicating to the semen or the sperm. महाभौतिक डोमिनेंस की बात करें तो आपके और सौम्य स्वभाव का होता है। दोष प्रीडोमिनेंस की बात करें धातुओं के अंदर तो शुक्र धातु के अंदर श्लेष्मा या कफ दोष प्रधान या पाया जाता है। सो इन ए नटशेल वी कैन से दैट शुक्र इज identified as a multifaceted entity by the acharyas at different occasions with the different objectives. So some are the synonyms available in the texts which indicates like retas or roop dravya or ananda samudbhav or tej which indicates towards the semen. So semen facet of the shukra dhatu. Again somewhere it is denoted by the bees or punsatva which are denoting the sperm. Again वीर्य पौरुष और बल शब्द का इस्तेमाल भी शुक्र के लिए किया गया है जो कि टेस्टोस्टेरोन की तरफ इंगित करता है। उसके अलावा जो शुक्र धातु का सर्व शरीर गतत्व के बारे में भी कहा गया है। तो जो सुश्रुत निदान में 10वें चैप्टर में जो जहां पर स्तन्य की बात आई है वहीं पर उसकी स्तन्य की उपमा शुक्र से दी गई है कि विशस्तेषु अपि गात्रेषु यथा शुक्रम न दृश्यते। विशस्तेषु अपि गात्रेषु यानी कि छेदन करने पर भी गात्र का एक्सरसाइज करने पर भी कुछ शुक्र दिखाई नहीं देता है। तो वैसे ही वो क्यों नहीं दिखाई देता? सर्वदेह आश्रित तत्वात्, कि वो सर्वदेह में आश्रित किसी एक स्थान पर नहीं है। तो ये शुक्र का लक्षण बताया, ऐसे ही स्तन्य का लक्षण बताया है। तो ये उपमा वहां पर दी गई है। उसके अलावा एक और उपमा आई जो है यथा पयसी सर्पी तू गूढ़श्च इक्षो रसो यथा शरीरेषु तथा शुक्रम निर्णाम विद्या भीषक वर है। जैसे कि दूध के अंदर घी या फिर इक्षु के अंदर इक्षु रस यानी कि गुड़ छुपा हुआ रहता है, वही शरीर के अंदर शुक्र छुपा हुआ रहता है। यानी कि आप उसको डायरेक्टली विजिबली जिस फॉर्म के अंदर सीमेन एक्सक्रीट होता है उस फॉर्म के अंदर हम उसको एक्सीजन के द्वारा डायरेक्ट प्रत्यक्ष नहीं देख सकते, बिकॉज इट इज ए मिक्सचर ऑफ द वेरियस सिक्रीशंस एंड द वेरियस पार्ट्स ऑफ द मेल रिप्रोडक्टिव सिस्टम। सो और दूसरा एक एक्सप्लेनेशन यहाँ पे ये भी टीका में दिया हुआ था कि जो पय और सर्पी का एक उदाहरण दिया है वैसे इक्षु और इक्षु रस का दिया है। तो जो कफज प्रकृति के व्यक्ति होते हैं जो जिसमें कि शुक्र की मात्रा या सीमेन की मात्रा जो हाई क्वांटिटी में एजुकेशन करते हैं सीमेन का, तो उनके लिए पय और सर्पी का उदाहरण है। तो कम मात्रा में अल्प रेतस वाले जो हैं जैसे वात प्रकृति वाले लोग, उनके लिए इक्षु रस का एग्जाम्पल दिया गया है। उसके बाद शुक्र व स्रोतस और शुक्र धरा कला दो एनाटॉमिकल एंटिटी और बताई गई है। मैम ने भी बताया कि इससे पहले एक वेबिनार एनाटॉमिकल एस्पेक्ट पे हो चुका है, वो मैंने सुना नहीं था, तो मे भी वहां भी ये चीजें डिस्कस हुई। तो मैं शॉर्ट में बताना चाहूंगा यहाँ पे कि शुक्र व स्रोतस के बारे में इसके मूल जो बताए गए हैं वहां पर 3 मेन पार्ट का जिक्र आया है, वृषण, स्तन और शेर। वृषण यानी कि टेस्टिस, तो हम समझ सकते हैं डायरेक्टली कि स्पर्मेटोजेनेसिस एंड टेस्टोस्टेरोन सिक्रीशन की प्राइमरी साइट है वृषण, तो इसलिए इसको समझा जा सकता है शुक्र व स्रोतस का मूल। उसके अलावा शेप और द पीनस इज द मेल कोपुलेटरी ऑर्गन, सो इट इज ऑल्सो जस्टिफाइबल हेयर। बट द स्तन स्तन को कैसे हम शुक्र व स्रोतस के मूल में आचार्यों ने काउंट किया है, तो उसका एक एड होक जंक्चर हम लगाकर इसको समझ सकते हैं। बट आई कैन नॉट कॉमेंट दैट हाउ मच एक्सटेंट इट इज राइट और रॉन्ग। जैसे कि स्तन्य एंड शुक्र both are pervaded throughout the body and both are under the influence of the similar factors like desire arising out of touch, sight or memory and prolactin and oxytocin. So जो मॉडर्न फिजियोलॉजी देखें इनके प्रवर्तन की, इनके जनन की या इनके एक्सपल्शन की, तो वहां पर सिमिलर फैक्टर्स हैं उसके पीछे। तो ये एक कारण हो सकता है स्तन्य का, स्तन को इसका मूल बताने का। उसके बाद शुक्रधरा कला है। शुक्रधरा कला में भी सर्व शरीर व्यापी भी बताया, लेकिन उससे पहले सप्तमी शुक्रधरा नाम द्वय अंगुले दक्षिणी पार्श्व बस्ती द्वार से आगो, बस्ती द्वार के नीचे 2 अंगुल दक्षिण पार्श्व के अंदर उसका स्थान बताया गया है। मूत्र मार्गम आश्रिता, तो ये तो यूरिथ्रा मेल यूरिथ्रा हमें पता है कि वो दोनों ही काम करता है, एजुकेशन के साथ साथ यूरिनरी एक्सक्रीशन का भी। उसके बाद सकल शरीर व्यापिनी अगेन बोल दिया। तो जो अल्टीमेटली जो शुक्र की जो एक परिकल्पना है सर्व देह व्यापी, शायद उसी की वजह से उसका जनन भी सर्वदेह व्यापी होगा, या फिर वो सर्वदेह के अंदर असुप्त अवस्था के अंदर एज ए फॉर्म इन द फॉर्म ऑफ एंड्रोजन्स प्रेजेंट होता है। तो उसी से हम इसको समझ सकते हैं। बाकी अगर 2 अंगुल जो दक्षिण पार्श्व में नाभि के नीचे बताई गई है, दैट इज द प्लेस ऑफ द सेमिनिफेरस ट्यूबुल्स और द टेस्टिस, लाइक दी स्ट्रक्चर्स और द एसेसरी सेक्स ऑर्गन्स, जहां से कि हमने देखा कि एसेसरी सेक्स ऑर्गन्स आर रिस्पॉन्सिबल फॉर द 90% कंस्ट्रक्शन ऑफ द सीमेन, एजुकेटेड सीमेन। सो उसके बाद है कि शुक्र धातु का प्रोडक्शन और उसका पोषण, प्रोडक्शन एंड नरिशमेंट। तो धातु चाहे कोई सी भी है, उसका प्रोडक्शन और नरिशमेंट की मैकेनिज्म जो एक कॉमन है, जिसके अंदर अनेकों शरीर क्रियात्मक थ्योरीज है। उसमें सबसे लॉजिकल और रीजनिंग वाली जो थ्योरी है, एक काला धातु पोषण पक्ष। व्यान वायु के द्वारा रस धातु का या आहार रस का संपूर्ण शरीर में विक्षेपण होता है, यानी कि सर्कुलेशन होता है। और उसके विक्षेपण के फलस्वरूप आहार रसात एक कालम, एक ही समय पर सप्तसु धातु स्रोतसु प्रवेशितात, सातों धातु स्रोतों के अंदर एक साथ प्रवेश के कारण रस रक्तादि धातु उत्पन्न, रस रक्तादि धातुओं की उत्पत्ति होती है। तो ऐसे ही शुक्र की उत्पत्ति होती है एक साथ। अब डिफरेंस कहाँ आता है कि ये तो रस का भ्रमण हो गया, उसके बाद उस रस से, आहार रस से जो शुक्र धातु बनेगी तो कितनी बनेगी, वहां पर आहार का क्या रोल है, या औषधियों का क्या रोल है, या अग्नि का क्या रोल है, अग्नि में भी जाठराग्नि और धातु अग्नि, वहां पर बात आ जाती है चिकित्सा की दृष्टि से। तो एज पर द कॉमन फंडामेंटल, बेसिक फंडामेंटल ऑफ द आयुर्वेद, सर्वदा सर्व भावानाम सामान्यम वृद्धि कारणम। तो इस सिद्धांत के अनुसार जितने भी वृक्ष आदि प्रभाव वाले द्रव्य हैं, चाहे वो आहार द्रव्य हैं, चाहे वो औषध द्रव्य हैं, और वाजीकरण औषधियां जितनी भी है, वो स्वबल गुण उत्कर्षात विरेचन व उपयुक्ता शुक्रम शुक्रम शीघ्रम विरेचयन्ति। वो शीघ्रता पूर्वक, क्योंकि वो उनका वो गुणों में शुक्र के समान है, तो सर्वदा सर्वभावना सामान्य वृद्धि कारण सिद्धांत से उनसे शुक्र की पुष्टि शीघ्र होगी और ज्यादा होगी इन कंपैरिजन टू द अदर धातु। तो ये आहार और औषध का रोल आ जाता है। उसके बाद में अग्नि। तो अग्नि के बारे में ये जो भ्रमण की बात आई है, वहीं पर जो अगला श्लोक है, संतत्य भोज्य धातु नाम पर परिवृत्तिस्तु चक्रवत। तो जो भोज्य धातु जो है, जिससे कि आगे धातु का निर्माण होना है, पोष्य धातु का निर्माण जिससे होना है, वो उसकी चक्र की तरह प्रवृत्ति होती है, परिवृत्ति होती है। तो इसको जो चक्रपाणी ने एक्सप्लेन किया है कि जैसे हम कुएं से जल निकालते हैं, तो जो बाहुओं में जितना बल होता है, उसी बल के अनुसार कुआं भी वो सेम है, वो उसके इक्विपमेंट्स भी सेम है, लेकिन उस बल के प्रभाव से एक व्यक्ति ज्यादा पानी निकाल पाता है उतने ही ड्यूरेशन में, दूसरा व्यक्ति उतने ही ड्यूरेशन में कम पानी निकाल पाता है। तो ये उदाहरण या उपमा देकर बताया गया है कि जिसकी अग्नि, जाठराग्नि और धात्वाग्नि तीक्ष्ण है या ऑप्टिमल स्टेट में है, तीक्ष्ण मैं नहीं कहूंगा, ऑप्टिमल स्टेट में है, जिसकी सम अग्नि है, अच्छी स्टेट में है, तो उसके अंदर जो एक यूजुअल टाइम पीरियड बताया गया, एवं मासेन रसाय शुक्री भवती स्त्री नाम से आर्तवम। तो दीप्त आग्नेस्तु किंचित न्यूनेन मासेन शुक्रम भवती, मंदाग्नेस्तु किंचित अधिकेन मासेन अयम अर्थो न्याय इति। यानी कि मंदाग्नि वाले के अंदर जो एक नॉर्मल ड्यूरेशन 1 मंथ की बताई है, जैसे कि स्पर्मेटोजेनेसिस में हमने देखा कि 65 to 75 डेज है, तो मंदाग्नि वाले की वो ड्यूरेशन बढ़ जाएगी, और दीप्त अग्नि वाले की वो ड्यूरेशन कम हो जाएगी। तो अल्टीमेटली जब हम अग्नि को, आहार को, औषध को अगर एड्रेस कर लेते हैं युक्ति पूर्वक, देन इन द केसेस ऑफ इनफर्टिलिटी और द अदर मेल reproductive dysfunctions in which spermatogenesis is hampered can be corrected easily. So अब हम अगर इसके hormonal उसकी बात करें कि किस हार्मोन से क्या होता है, उसके फंक्शंस के हिसाब से अगर अग्नि की पहचान करें, तो एफएसएस जो फॉलिकल स्टिमुलेटिंग हार्मोन है, जो कि सर्टेली सेल्स को हेल्प करता है नरिशमेंट करने में स्पर्मेटिड्स का, तो उसको रस धात्वाग्नि से कंपेयर किया जा सकता है। यानी कि अगर मतलब ये मेरा विषय नहीं है, तो अगला जो वेबिनार होगा उसके अंदर जैसे पैथोलॉजी डिस्कस की जाएगी, तो पैथोलॉजी जो संप्राप्ति विघटन है, तो संप्राप्ति विघटन में किस स्टेज का, किस कहाँ पर संप्राप्ति है, उसको कैसे विघटित करना है, तो ये फिजियोलॉजी के अंदर कहाँ डिफेक्ट है, तो किस आयुर्वेद के अनुसार किस धात्वाग्नि का या किस स्रोतस की दुष्टि है, उसके अनुसार ड्रग ऑफ चॉइस भी चेंज करनी पड़ेगी हमें। तो एफएसएच को जनरली रिजेम्बलेंस लिया जाता है कि रस धात्वाग्नि से, जो कि आगे शुक्र की पुष्टि के लिए शुक्र धात्वाग्नि को मटेरियल प्रोवाइड करता है। एंड एंड्रोजेंस, जिसके अंदर की टेस्टोस्टेरोन और एड्रिनोकोर्टिको कोर्टिकोइड हॉर्मोन्स जो आते हैं, एड्रिनो एड्रिनल सेक्स स्टेरॉइड जो आते हैं, एंड ल्यूटिनाइजिंग हार्मोन सिक्रेटेड फ्रॉम द एंटीरियर पिट्यूटरी, उन दोनों को शुक्र धात्वाग्नि के रूप में देखा जाता है, बिकॉज इनका डायरेक्ट फंक्शन होता है ऑन द इनकी बिल्डिंग ब्लॉक्स रिस्पॉन्सिबल फॉर द फॉर्मेशन ऑफ द स्पर्मेटोजेनेसिस, तो जिससे फाइनली स्पर्म का फॉर्मेशन होता है। उसके बाद एक ऑटोनोमिक कंट्रोल भी इसमें महत्वपूर्ण उसकी भूमिका है, जिसमें कि वायु का रोल है। तो बहुत सारे इनफर्टिलिटी के जो स्पेशलाइज्ड क्लिनिक्स चलाते हैं हमारे प्रैक्टिशनर्स हैं, उन्होंने ऑब्जर्व किया होगा कि कई बार धातु में दुष्टि नहीं होकर उसके ऑटोनोमिक कंट्रोल में कहीं ना कहीं दुष्टि होती है। तो उसको अगर ठीक कर दिया जाए, वायु को अगर अनुलोमन करना है या वायु का शमन करना है, वायु को करेक्ट अगर कर दिया जाए, तो भी रिजल्ट्स मिल जाते हैं। तो यहाँ पर जो हाइपोथैलेमो पिट्यूटरी गोनेडल एक्सिस की जो फंक्शनिंग है, उसको प्राण, उदान और समान वायु के फंक्शंस के की तरह देखा जाता है। और जो एसेसरी सेक्स ग्लैंड्स के जो सिक्रीशंस हैं, उनको व्यान वायु के प्रॉपर फंक्शंस के रूप में देखा जाता है। एंड जो ऑक्सीटोसिन का जो फंक्शन है, जो कॉन्ट्रैक्शन एट द टाइम ऑफ एजिकुलेशन, दैट इज कंसिडर्ड अंडर द फंक्शन ऑफ अपान वायु, जो कि गर्भ निष्क्रमण या शुक्र या आर्तव इनके निष्क्रमण में काम आता है। तो अल्टीमेटली अगर वायु, धात्वग्नि और धातु को उत्पन्न करने वाले जो औषध और आहार द्रव्य, यही 3-4 चीजें हैं जिनको कि हम आगे फर्दर डिस्कस करेंगे, जो हमारे आगे वेबिनार होंगे पैथोजेनेसिस से रिलेटेड या इनफर्टिलिटी से रिलेटेड। तो इसके साथ ही ये मेरी प्रेजेंटेशन समाप्त होती है। थैंक यू।
Thank you, Dr. Arvind. It was really optimum presentation. You have compiled both the aspects, modern as well as Ayurveda, and it was really expected from you. Congratulations and thank you so much.
Thank
Now
you,
I
ma'am.
would like to invite second speaker. Are you there? Have you?
Yes, madam. Yes, ma'am.
Yeah. Now I would like to invite Dr. Arun Ramachandran. He is Associate Professor and HOD at the Netra Chikisala, Amreli, Gujarat. So he is an expert from the physiology. So he will throw further light upon the subject. Over to you, Dr. Arun.
Thank you, madam. Respected Sri Kamini Divan, madam. Agnihotri, sir. Vishnu Prasad Sharma, sir. Then Arvind Agrawal, sir. So, first of all, I am thankful for giving such an opportunity in this wonderful session. So first, we have had a wonderful session on physiological aspects of Shukra Nirmana and spermatogenesis. Now, I'll be trying my best to contribute from the different concept that Acharyas has told in the Madam, can you see the?
Yes, it is in slideshow mode. Nice.
Yes.
You go.
So, trying the best to explain what Ayurveda has contributed or Ayurveda has explained regarding the concept of Shukra Nirmana, and up to which extent we can equate or we can understand it from the contemporary science. So it's a humble effort from that particular point of view. So the preliminary, so the main contents in this particular presentation is the functional anatomy, which is already explained wonderfully. Now, the second most important topic is the blood-testis barrier. So why blood-testis barrier is important? Because from the current incidence of male infertility, around 30 to 40% of cases are actually idiopathic male infertility cases. So coming to the etiology of this particular condition, it is believed that the most common cause for this such condition is the exposure of the baby during the neonatal period to the environmental pollutants which may be causing non-reversible damage to the blood testicular barrier and even the epigenetic factors also. So now whatever trends are showing, the latest treatment methodologies which are research is going in the field of male infertility, majority of them are focusing upon crossing this blood testicular barrier and how can directly reach at the level of seminiferous tubules and can rectify the aberrant seminal features. Now, in the next thing, we will be checking the influencing factors of spermatogenesis. Then later we will be checking Shukra Nirmana and how to understand it from the modern parlance. So coming to spermatogenesis. So spermatogenesis is comparatively a lengthy procedure. So the overall time duration which is required for spermatogenesis reaches almost 72 to 74 days. But in certain cases, it can reach up to 40 to 70 days. We can reach the complete process of spermatogenesis. On an average basis, around 150 to 300 million sperms are produced on a daily basis in a adult human body inside the seminiferous tubules. But the fact is that only half of the sperm produced among this 150 to 300 million are viable for the body. Now we'll be going towards the blood testis barrier. So a blood testis barrier is a mechanical barrier, but the thing is it's a dynamic mechanical barrier, just similar to the blood brain barrier. So Ayurveda has medications which can cross this blood brain barrier and can give targeted drug delivery. So when we are going to the latest researchers which are going in the main infertility field, in a research actually in a paper published like bibliometric and visual analysis of blood testis barrier research, it was given that almost 900 researchers are going in, especially for this particular blood testicular barrier targeted treatment methodology and drug delivery system in improving male infertility cases. So among them, almost majority of the cases are handled by the traditional Chinese medicine. Almost 50% of them are handled by traditional Chinese medicine. So surely Ayurveda has a lot to do in this particular field. Actually, there are many medications like Abraga and all the which can cause this particular thing. And there are certain studies like fructus laceae, that is Himalayan goji and all, which can cross this particular barrier and can lead to changes in the blood testis barrier. That's an animal experiment, but it's a positive result which is done by traditional Chinese medicine. So in this particular system, this blood testis barrier, it converts the seminiferous tubules into two chambers, first the basal compartment and the apical compartment. So once the sperm is getting matured from the spermatogonium, then to the primary, secondary spermatocyte, spermatid, and later towards the mature sperm, they will be moving from the periphery towards the central portion. So why this blood testis barrier is essential? Because the blood vessel always carries toxic substances which may be harmful for the environment, which is essential for spermatogenesis. And the second most important reason for during the process of spermatogenesis, there are many aberrant metabolites which are produced inside the seminiferous tubule. And once it is exposed to the blood circulation, there may be autoimmune reactions, and that can again lead to infertility. So it is a protective measure. But whether the doubt is whether this blood testis barrier is completely foolproof, no. Actually, it has the privilege and capacity to send the things which are essential for spermatogenesis, like amino acids, hormone, nutritive substances. These all substances can cross the blood testis barrier and reach the seminiferous tubules. But for all the other things, those toxic substances, it prevents the entry of such substances. So a drug delivery pattern which can cross or which can take the molecule from the blood circular system through the different transporter mechanism in blood testis barrier surely will be a great boon in the management of male infertility. Now, coming to the stages in spermatogenesis. Spermatogenesis is having three main phases. First one is the spermatocytogenesis, then spermatidogenesis, and spermiogenesis. So in the initial stage, that is, which is already explained now, so I will condense the content in brief. In the first phase, that is spermatocytogenesis, the primordial germ cell, which is in the case of which is seen in the body in the gonads, that will be getting activated once it reaches the phase of maturity by around 13 years or by 15 years of age. Then they will be going through a series of divisions, mitotic divisions inside the body. Then they will be making into a particular type of cells known as spermatocytes. That is the first phase. Now in the second phase, the secondary spermatocyte, after undergoing a meiotic division, that will be forming the cell known as spermatid. And in the final stage, the spermatid will be undergoing a series of changes to form the fully mature sperm. So this is one point of view of understanding spermatogenesis. Now coming to the second thing, it can happen in 4 phases. First one is the stage of proliferation. Second one is the stage of growth. Third, the stage of maturation, and stage of transformation. So during the phase of proliferation, what happened? The diploid spermatogonia, which is having 23 pairs of chromosome, it divides by mitosis. Then it will be going through a series of multiplication or division. In brief, there are 7 generations of spermatogonia will be produced before it is reaching to the stage of primary spermatocyte. Then during proliferative stage, what happens? This primary spermatocyte, in this particular phase, it will be leaving towards the lumen of the seminiferous tubule by taking the Sertoli cells along with them. Now coming to the second phase, that is the stage of growth. Here, the primary spermatocyte which was produced, it only undergoes a series of growth. Apart from that, not much changes going in this particular phase. Now in the third stage, that is maturation. In the maturation phase, what happens? In the preliminary phase, the primary spermatocyte will be converting into a secondary spermatocyte. And the subsequent phase, it will be converting into the spermatid. Now the last stage is the stage of maturation, where this particular spermatid will be converted into the mature motile spermatozoa by means of a process termed as spermiogenesis. So in spermiogenesis, or in the stage of maturation, it undergoes a series of changes. First one on the left side can see the spermatid. In that spermatid, the nuclear material, whichever is available, it will be undergoing a series of condensation procedure. After that, what happens? There will be formation of acrosome. The mitochondrial flagella will be forming, which will be later the tail portion will be extended. And in the final stage, it will be forming the fully matured sperm, which is having a head, midpiece, and tail portion. So the most important thing is, even after it is acquired the phase of the final anatomical position, it's the maturation will be only complete when it reaches the epididymis. So for attaining the complete motility, the spermatozoa should pass through the epididymis. That is a mandatory thing. Now coming to the time duration which is required for spermatogenesis. So it was mentioned that around 74 days of time is required for the complete process of conversion of spermatogonia into a mature sperm. In that, almost 25 days of time is required for the conversion of a spermatogonia after undergoing 7 series of multiplication to form a primary spermatocyte. Then again, 9 days of time duration is required for converting primary spermatocyte into a secondary spermatocyte by means of a first meiotic division. Then 19 days time is required for the secondary spermatocyte to get converted into the spermatid. And in the last phase, around 21 days time is required for the final conversion of spermatid into a mature sperm. Now, coming to the factors which are influencing spermatogenesis. So how many factors are there which are influencing spermatogenesis in total? So the most important or the necessary factor which is required for spermatogenesis is the presence of hormones. So the first and initial hormone which is required for spermatogenesis to start, that is the follicular stimulating hormone, or it is considered as the initiator of spermatogenesis. And that extends its action at the phase of stage of proliferation. Then in the stage of proliferation, where the spermatogonia will be undergoing mitotic division to form the spermatocyte, mainly two hormones, that is FSH and the growth hormone, that is the GH, will be acting. So GH will be having a very specific function, that is, it will be extending in action in proliferation, growth, and maturation phase. It will be helping in maintaining the general metabolic processes that is taking place inside a developing spermatogonia or spermatocyte. So once the preliminary phase of stage of proliferation is finished, then the sperm will be passing on to the developing sperm will be passing on to the next phase, that is the stage of growth. So the important thing is that from the stage of growth, the entire process will be taken over by testosterone from the FSH. That is very essential for the maintenance of spermatogenesis. So stage of growth, maturation, and transformation, which is the last phase, all these phases are properly modulated by testosterone. And in which the growth and maturation phases, it is aided by growth hormone also. Now there is the phase known as the spermiogenesis, which is aptly explained by Arvindji. Actually, spermiogenesis is the process in which the spermatids are converted into the mature sperm, and it is under the control of estrogen. So estrogen is regulating this particular spermiogenesis process. It is extending its role in spermatogenesis. And above all these things, we are told that testosterone is required for the maintenance of spermatogenesis, and even it is under the control of LH, or luteinizing hormone, which is secreted, which is essential for the secretion of testosterone from the Leydig cell. And this is the general hormone which are required for the process of spermatogenesis. And apart from that, there are two other hormones which are playing a very vital role. First one is the inhibin. So what exactly inhibition is doing? It is doing a feedback mechanism. So whenever the FSH hormone secretion is increased inside the body, so automatically inhibin will be secreted, and by the feedback mechanism, it will be controlling the secretion of FSH. And if the body requires more secretion of FSH, then the other enzyme which is playing a role entirely opposite to that of inhibin, that is activin, will be activated. So this is a pictorial representation of the role of different hormones in spermatogenesis. So you can see first one, the most important thing which is playing a role in spermatogenesis is the hypothalamo-pituitary gonadal axis, or the HPG axis. So it starts from the gonadotropin releasing hormone from the hypothalamus, which is extending its control over the two major hormones in spermatogenesis, that is follicular stimulating hormone and luteinizing hormone. So the follicular stimulating hormone, which is considered as the initiator, it is released from the Sertoli cells, and even the control of FSH cells is regulated by two hormones, that is inhibin and activin from the Sertoli cells by feedback mechanism. Now, throughout this process, the GH, growth hormone, will be playing a very vital role in regulating the spermatogenesis process. So by looking at that, we can understand that from a modern point of view, the hormonal mechanism plays a very vital role at which pace actually the sperms are dividing inside the seminiferous tubules. And also, the blood testicular barrier is playing a very vital role in deciding which fractors are to be taken inside the seminiferous tubules. Now, along with the hormonal factors, there is another cell which is playing a very significant role, that is the Sertoli cells. So the Sertoli cells are providing the hormonal substance which are necessary for spermatogenesis. Then the second one, it is secreting an androgen binding protein, which is essential for testosterone. So whenever this spermatogenesis has to be maintained in a proper way, this secretion of androgen binding protein is very essential. So any pathology in case of a Sertoli cell can surely affect the proper functioning of testosterone inside the body. And the final function that is also important, because the sperms will be attaining its proper motility only when it is released from the seminiferous tubule. So Sertoli cells are also essential for releasing sperms into the lumen of seminiferous tubule. Now, coming from the practical point of view, what are the other factors or lifestyle factors which are influencing spermatogenesis? The most important factor is the increase in body temperature. So increase in body temperature, it can be an environmental increase in body temperature, or it can be the working environment, working in a hot environment or in a kitchen environment. Those all things can influence the general body temperature. And when general body temperature increases, what exactly the change is happening, it leads to the degeneration of seminiferous tubules. So maintaining amp body temperature, apart from maintaining the genital body temperature, is a very essential factor for regulating the pace of spermatogenesis. Now, second most important factor is modifiable lifestyles like alcohol consumption, nicotine addiction, that is smoking, and exposure to electromagnetic radiation emitting devices. So any device which emits electromagnetic radiation, it can lead to oxidative stress. Then this oxidative stress is having its direct impact on blood testicular barrier, and it can lead to errors in spermatogenesis. Now, coming to the foods what we are consuming, one food which is having a very significant impact on spermatogenesis is the increased intake of trans omega-6 fatty acid, especially the prepared foods like the lipids which are used in preparation of popcorn and all. And they will be leading to a deterioration of testicular endocrine function if it is used in excessive quantity. Then genital heat stress. So genital heat stress, the increased temperature in the specific genital area, especially in common incidents, it can seen in person who are drivers, who are sitting for a longer period of time, or even the person who are sitting for a longer duration of time for completing their work. In them, what happens, the local increased heat stress can lead to a change in the sperm DNA pattern, and that can lead to aberration in spermatogenesis. And the next one is the psychological stress, which is one of the most important causative factors for erectile dysfunction and all. And here again, the impaired testosterone secretion, that is the most the psychological stress will be leading to impaired testosterone secretion and will be affecting the spermatogenesis. And apart from that, there are certain medications which are commonly used by the patients, like calcium channel blockers, antidepressants. These all things are having modifiable action in the spermatogenesis procedure. So coming from the modern point of view, the thing is that spermatogenesis is a lengthy procedure which takes almost 74 days from the starting phase of spermatogonia till the end phase of the mature motile sperm. It takes almost 74 days. And there are factors which are influencing this particular process. Especially one factor is the hormonal factor, which are regulated by the hypothalamo-pituitary gonadal axis. And second one is the environment of the seminiferous tubule, especially the nature of the Sertoli cells. And the third factor is the modifiable factors or the lifestyle of the patient. It can have a very strong impact on spermatogenesis, which almost matches with whatever description Ayurvedic literatures has given through the Shukra Nirmana and the factors which are affecting Shukra Ulpati. The same parallels we can see in this particular context. Now we can move to the most important section from our point of view, that is what exactly is Shukra, and whether the Shukra Dhatu is sperm or whether the Shukra Dhatu can be equated with any other things inside the body. So there are many opinions. So this is only one point of view. Mistakes can be there. So other interpretations can be there for this particular thing. So the term Shukra it is derived from the root that is Shuj Nikutwa. It means the dhatu which exists in the purest form. So coming to the Panchabodhika predominance, actually Acharya Charaka has mentioned that Shukra Dhatu is having specifically 4 Mahabhutas in its predominance, apart from Akasha Mahabhuta. But Acharya Chakrapani has in detail explained that actually Shukra Dhatu is having all the 5 Mahabhutas in its constitution. But since Akasha Mahabhuta is omnipresent in nature, Vibhu in nature, at the time of the release, the Shukra Dhatu which is released, it is having only 4 Mahabhutas. That is from the structural point of view. But from the functional point of view, we can understand that Shukra Dhatu is having up Mahabhuta predominance. That is, it is equivalent to the Jala Mahabhuta and its properties. And its quantity pramana is normally explained as Artha Anjali. So there may be a confusion how exactly Artha Anjali can be the pramana of Shukra. And it can be the highest volume of Shukra Dhatu that can be observed inside the body. Now, coming to the understanding by equating with the modern parlance. So the concept which was explained as Shukra Dhatu, we have to consider the other factors like sperm, semen and the contents. So semen and the contents, it include the fluid from the seminal vesicle and the fluid from the prostate gland. So coming to the semen in total, so it will be having 90% of secretory portion and 10% of sperm portion. And also the most key factor which is which should be considered is the androgens which are present, that especially more than 90% of androgen component is the testosterone. So from Ayurvedic point of view, the Shukra Dhatu, it includes the reproductive tissue, that is the sperm, then the semen and its liquid contents, and along with the androgenic part, that is the testosterone part, altogether can be equated as Shukra Dhatu in Ayurvedic point of view. So from considering this, the mature sperm is the Bija Rupi Shukra, which is most important for doing the most predominant function of Shukra Dhatu, that is Garbhodpada. And along with that, there is Dhatu Rupi Dravya, that is which can be observed, which is visible, that is the semen. So how we can understand that all these from the descriptions in Ayurveda, we can have a deduction that the Shukra Dhatu should include all the 3 components, because Shukra Dhatu is having function at 3 levels. First one is the systemic function, that is Sarva Dehika. Then second one is related to the sexual act or Maithuna Gata. And third one, which is the visible part, that is Rupa Dravya Gata. So in the systemic function, that is the explanation given by Acharya Dalhana, he has explained 2 systemic functions of Shukra Dhatu. First one is Deha Upajaya and second one is Utsaha. So these 2 functions are clearly indicative of the functions of androgens inside the body, which is very essential for developing the masculine nature of the body and also the enthusiasm to be provided, that is attributed to the androgenic portion, that is the Sarvadihya Karma, and also Ojo portion. Now related to the sexual act, it includes Shavana, that is the release of sperm. The release of sperm, that is Preeti, and Harsha, that is the happiness during the process of sexual intercourse, that is related to the function of Shukra Dhatu related to the sexual act. And the last one is the function of seminal fluid, that is the Rupa Dravya Gata, which is providing a alkaline environment for this particular sperm to have an action. Now the next thing, whether Shukra Dhatu is applicable in case of females or not, this is a topic of discussion, but there is a concept called as the Shukra Dhatu in as explained by Bhava Prakasha. But the thing is that it is not the reproductive tissue. So coming to the Sreshta Karma of Dhatu, it is being explained as Garbhodpada is the Sreshta Karma, but Artava is attributed as the reproductive tissue in case of females, which is the remaining portion compared with the semen and the liquid secretory portion is equated with the Shukra Dhatu or Shukra Dhatu in case of females, which is mainly can be considered as the secretion of glands of Bartholin glands or endometrial glands, which will be the most equivalent comparison with the concept of Sri Shukra. Now, where exactly is the Shukra Dhatu is actually localized inside the body, which is already explained. But for understanding why it should be equated with testosterones and all, we have to check the specific location. From it is mentioned that Sarva Sharira Vyapi. So the Shukra Dhatu is having an extensive function. Its circulation throughout the body, which can be observed in case of testosterone, even though it is more localized in case of gonads. Then the next function, it is the second part is it is Bhudascha Yatha Payasi Sarpistu Bhudascha Ikshau Raso Yatha. So this particular Shukra component is Budha, that is invisible. So that invisible part is the sperm, which is having the reproductive function, and the Sarva Sharira Vyapi, that part is the androgenic part, which is especially the testosterone part, which is also responsible for upajaya and enthusiasm. Now coming to the concept of Shukra Nirmana. So Ayurveda has proposed different Dhatu Poshana Nyayas, that is Kshira Dadi Nyaya, Ketara Gulya Nyaya, Khale Kapoda Nyaya, for explaining this particular process. So the reference from Grahani Chikilsa, which goes like this: Majjascha Parinamena Yati Shukram Pravartade Sarvadeha Gatam Shukram Pravadanti Manishinaha Tadha Asti Madhya Majjascha Shukram Bhavadi Dehina. So it is proposed that this Shukra Dhatu is derived from Majja. So that is the Uttara Dhatu Parinamavada. So here we have to consider it from 2 points of view. First one, it is derived from Majja Dhatu based upon the qualitative part. That is, it is explained that the Shukra is developed from the Majja Sneha. So it has to signify, even though Majja is a Snigdha Dhatu, Shukra is again formed from the much more Snigdhata portion of the Majja Dhatu. That is the, it is highly Snigdha in nature. And the second part, which we can understand from the anatomical point of view or the structural point of view, the recent studies which we are discussing from time to time, that is how the bone marrow derived mesenchymal cells are playing a very vital role in the production of spermatogonia inside the body. There are many studies, many papers which are highlighting this particular content. So two things are there. This Majja Sneha should be considered from the qualitative point of view. And then coming to the structural point of view, this Majja is also having the cells of mesenchymal cells is also having a very particular role. Now, then Shukra Nirmana, there are different terminologies that we are using in Ayurveda classics. So two more common terminologies that we use in the context is one is Vrishya and second one is Vajikarana. So there may be a doubt actually what is Vrishya and what is Vajikarana and what exactly is the difference in between them. So this is a clarification has given by Acharya Dalhana, and this particular thing is explained while explaining the quality of Kshira, qualities of Kshira. The two terminologies are explained. First one is Vrishya. It is being explained that is Shukra Janaga. So the spermatogenic property. So we are discussing about spermatogenesis and then we are comparing it with Shukra Nirmana. So the Shukra Nirmana process, which is explained in Grahani Chikilsa, it starts from the spermatogenic process and then it is going towards the release of Shukra Dhatu, how it is happening inside the body. So Shukra Janaga, that is mainly Vrishya is the terminology attributed to the things which is having Shukra Janaga property, and Vajikarana is the terminology which is given to the things which is having Shukra Pravartaka property. Then, so in total, we can summarize that from a spermatogenesis point of view from Ayurveda, Shukra Vaha Srotas is playing a very significant role from the point of view of Charaka, that is Vrishana and Sheva, which is acting as the Mulasthana. And from Susruda's point of view, he has included Stanya also from this particular angle. Then healthy Rasa Dhatu and Rasa Dhatu Agni, which is aptly pointed out in the previous presentation, how it can be equated with the hormonal role inside the body. Then balanced Jadar Agni as well as Dhatu Agni, especially the Shukra Dhatu Agni, how it is influencing the Shukra Nirmana. And specifically 3 Vada doshas along with Prana Vada, that is Samana, Vyana and Apana Vada, it is also playing a very vital role. Due to the similarity in property, Kapha dosha is having a highly significant role in the process of Shukra Nirmana. And the last one, the role played by Manas, since Ayurveda has pinpointed the importance of Manas and how it is influencing the body. So Manas is a factor which plays a very vital role in Shukra Nirmana. So while explaining the Shukra Nirmana process, in the initial part, Acharya has explained the formation of Shukra, which is from the Majja Dhatu, which we explained from 2 points of view. First one is the point of view from the quality, that is Majja Sneha, and second one is the quality from the modern parlance, which can be equated with the formation of mesenchymal cells from the bone marrow. Then this ejaculation part, which is explained in the later part by Acharya Charaka. So that is a physiological process which is under the control of autonomic nervous system, which is having 2 phases, that is emission and ejaculation. So while explaining the emission of the release of Shukra, it is explained that Basti is playing a very vital role. Basti is having a role to play during the release of sperma. So how it can be equated, how it can be understood. So that is from 2 things. First one, the prostate gland, which is located near the bladder, that is having a very significant role in the release of sperm. And the second one, the prostatic secretion ejection will be started only after the closure of neck of bladder. So the bladder neck closure is also having a very significant role in the release of prostatic secretion, which is mixed with spermatozoa and then later into the prostatic urethra. And it helps in maintaining the alkaline nature of the fluid. So coming to the influence of age in Shukra Utpatti, that is spermatogenesis. So there are 2 key ages has been quoted by Acharya Charaka. One is Narde Vai Shodasha Varshat Saptatya Bharato Nacha. So here before 16 years, so from practical point of view, around 13 to 15 point of view is the time where the spermatogonia again becomes activated in a male body and it starts the mitotic division. So coming to the next thing, Saptadi. So after 70, what happens? Why the spermatogenesis is getting reduced and why Acharya Charaka has specifically mentioned this thing? Because there are 2 factors which are responsible for that. First one is diminished testicular production of testosterone. So testosterone production will be diminished after 70 years old. Then the second factor is the hypothalamus secretion of GnRH, that is gonadotropin releasing hormone. So these 2 will be contributing to inadequate LH secretion. That is why after 70 years of age, there is a very significant drop in the level of spermatogenesis. So the next doubt which comes in our mind, so after 70, whether it is the end, so whether it is going to be a dead end from a physician point of view, but that is not what Ayurveda has told in the context of Vajikarana. So in coming to the context of Vajikarana, the definition of Vajikarana in Susruta Sutrasthana first chapter, he has mentioned about 4 particular conditions, that is Alpa, Shukra, Dushta Shukra, Kshina Shukra and Vishushka Retas. There are 4 conditions which is aptly pointed out by Acharya Susruta and later on which is explained by Acharya Dalhana. What exactly is Alpa Shukra, Alpa Retas means, what is Dushta Retas, what is Kshina Retas and what is Vishushka Retas. So there are, Ayurveda has planned certain treatment methodologies for all these conditions. The first one is the Alpareda. So Alpareda means naturally, which is the lesser quantity of sperm that is considered as Alpareda. So who is having this Alparedas? That is Athava Alparetasaha Pancha Vimshatim Apraptaha. So those person who has yet to reach 25 years, that is a physiological thing. It can be 22 to 30, whatever maybe. So before it reaches 25 years of age, we have to consider it as an Alpareda condition. So that particular condition, you have to adopt the Apyayana Chikitsa. We should follow Apyayana Chikitsa, you have to adopt. And then coming to the next one, that is Kshina Redas. So who is having Kshina Redas? Kshina Redas tu Madhya Vayasaha Karanat Alpi Bhuda Redasaha. So this Kshina Redas is taking place in case of a Madhya, that is Yavana Avastha. It is around 30 to 60 years of age, this particular thing happens. In that condition, we have to follow the Shukra Upachaya Chikitsa. And the last contact, that is Vishushka Retas. Vishushka Retas is Shushka Retaso Vruddhaha. So again, after 70, it is told that the rate of this will be decreasing. But again, Vachikirana Tantra is such a methodology, which is for this condition also Acharya has contributed a method, that is Janana. Shukra Janana is a treating methodology which is explained under Vachikirana Tantra. So, and the last one, that is Praharsha Jananartha. So Praharsha Janana, it is mainly related to Shukra Vruddhi Sruti Karanas. So it increases the sperm inside the body and Sruti Karana. So from a physical point of view, from a treatment point of view, there are two aspects. First one, the drugs which increases the rate of spermatogenesis, and second one is the thing which increases the Shukra Sruti, or the flow of release of sperm from the release of semen. So based upon the characteristic features, the drugs which is explained in Ayurveda, we can categorize into majorly 6 categories. First one is the Shukra Janaka Dravya, which facilitates spermatogenesis, also called as Shukra Vruddhikara. Then Shukra Pravartaga or Shukra Srutikara, which improves ejaculation. So we have told that Vrishya Aushadhi can have its action, but it may not be at the level of sperm. It can have action at the level of androgens which are circulating throughout the body. Then Shukra Rejaka, which is responsible for the complete evacuation. So among the 6 types, the most important group of drug which is significant from this particular presentation point of view is the Shukra Janaka Aushadhi, which increases the rate of spermatogenesis inside the body. They facilitate spermatogenesis. And how it is achieved? It is by the hormonal mechanism. It changes the action of FSH, LH, testosterone, HPG axis, that is hypothalamo-pituitary gonadal axis, and even the autonomic nervous system. So wonderfully, Ayurveda is having such an extensive list of medicine which can have Shukra Janaka action as well as Shukra Pravartaka, that is release of sperm. Then coming to the time taken for the formation of Shukra Dhatu. So the certain times there may be a controversy how a drug can be can increase the sperm with Shukra Dhatu within a short span of time, because Shukra Dhatu is having the components, that is sperm, semen, and even the androgenic component. So the Vrishya drugs or aphrodisiacs, when they are administered, that will be leading to an increase of harsha, or that will be leading to an increase of androgens inside the body. That will be reflected in the general reproductive health of the individual. So from Susruta's point of view, the time duration taken for the formation of Shukra Dhatu is 30 days, which almost equates with the time duration which is taken for the division of primary spermatogonia into the spermatocytes. Now, how we can understand it from the different Dhatu Poshana Nyayas. So Ayurveda has followed the Trividha Dhatu Poshana in the context that Acharya Dalhana has explained Trividha Dhatu Poshana. So the first thing is the Kshira Dhati Nyaya, or the theory of complete transformation. So it helps in understanding the completion of Poshaka Shukra Dhatu completely into the stable Shukra Dhatu inside the body. So that when we are applying the drugs which are Shukra Janaka, actually we are targeting at this particular point. Then Kedara Kulya Nyaya, it helps to understand the transportation of Poshaka Shukra Dhatu. So when we are giving Kshira, Kshira is the thing which is having both Shukra Janaka and Shukra Shrutigara property. So the nourishment of Shukra Dhatu by Kshira can be understood from the point of Kedara Kuddhi Nyaya. And then coming to the Khale Kapota Nyaya, it explains the action of Shukra Dhatuatni exclusively on Poshaka Majja Dhatu. That is, the immediate nourishment of Shukra Dhatu can be substantiated from this particular point of view. Thank you.
Thank you so much, Dr. Arun. It was excellent presentation from both the aspects. You are very good orator also. You has presented very nicely. Congratulations and thank you so much. And if Pawan sir allow, we can take up 1 or 2 questions. You are getting message super presentation.
Sure, madam. 1 or 2 questions we can take, then we will. Today, contradictory topics are there.
No, we
First
cannot
one-
say. हम उसको कॉन्ट्राडिक्टरी नहीं कहेंगे सर. ऐसा है ना कि सिक्के की 2 पहलू हैं. लाइफ के
बिल्कुल।
माइलस्टोन है. हाँ, तो दोनों ही एक ही सिक्के के दोनों पहलू हैं, जीवन के भी और तो बोल सकते हैं. कोई बात नहीं, तो वो भी लेना है. अगर 1-2 क्वेश्चन आएंगे तो लेंगे, नहीं तो वी विल शिफ्ट टू दैट.
नहीं, जरूर ले ली, जरूर लो।
हाँ, है कि कोई क्वेश्चन है नहीं है. बहुत अच्छा प्रेजेंटेशन. ऐसे ही मैसेज आ रहे हैं कि इट इज वेरी एक्सीलेंट प्रेजेंटेशन. ऐसे ही मैसेजेस हैं, तो वी कैन शिफ्ट टू सेकंड वेबिनार सर.